What is depression? We all experience sadness from time to time. It's a natural human emotion like a passing shower on a sunny day. But clinical depression is different. It's more like a persistent downpour that disrupts our lives. Depression is not a sign of weakness. It's a serious medical condition that requires understanding and support. Sadness is temporary. It fades away as situations change. Depression lingers, casting a long shadow over our thoughts, feelings, and behaviors. It's important to remember that depression is not a choice. It's a complex interplay of factors that impact our mental well-being. Recognizing the difference between sadness and depression is crucial. Sadness is a normal response to difficult events. Depression is a persistent state of low mood and loss of interest that affects daily functioning. If you're feeling down for an extended period, it's essential to reach out for professional help. Depression manifests in various ways, making it challenging to diagnose. Some common symptoms include persistent sadness, loss of interest in previously enjoyed activities, changes in appetite or weight, sleep disturbances, and feelings of worthlessness or guilt. These symptoms are not exhaustive, and their intensity can vary from person to person. Imagine feeling a heavy weight on your chest, making it difficult to breathe. That's how some people describe the emotional burden of depression. The world can seem bleak and hopeless, and even simple tasks can feel overwhelming. The fatigue associated with depression is not like ordinary tiredness. It's a deep-rooted exhaustion that seeps into every aspect of life, making it a struggle to get out of bed or face the day. If you or someone you know is experiencing several of these symptoms for 2 weeks or more, it's vital to seek professional help. Depression isn't just all in your head. Research has shown that it's linked to physical changes in the brain. For example, people with depression may have smaller frontal lobes, the part of the brain responsible for decision-making and emotional regulation. This can lead to difficulty concentrating, making decisions, and controlling impulses. Neurotransmitters, the chemical messengers in our brains, also play a role. Serotonin, dopamine, and norepinephrine are all involved in regulating mood, and imbalances in these neurotransmitters are linked to depression. Imagine a car engine sputtering because it's not getting enough fuel. These changes in brain structure and function help us understand why depression is a real medical condition and not just a state of mind. It's important to remember that depression is not a weakness or a character flaw, it's a result of complex biological factors. Section 4. Nature and Nurture. Unraveling the causes. The causes of depression are complex and multifaceted, often stemming from a combination of genetic predisposition and environmental factors. Genetics can make some individuals more susceptible to developing depression, while life events such as trauma, stress, or loss can trigger its onset. Think of it like a puzzle. Genetic factors might provide the pieces, while environmental factors determine how those pieces fit together to form the picture of depression. Childhood experiences, social support systems, and even physical health can influence the development and severity of depression. Understanding these causes is crucial for developing effective treatment plans and reducing the stigma surrounding mental health. It's important to approach depression with empathy and understanding, recognizing that it's not something people choose to experience. Section 5. Breaking the silence. Seeking timely help. Seeking help for depression is a sign of strength, not weakness. However, there's often a delay in seeking treatment, with the average person waiting over a decade to reach out for support. This delay can have significant consequences, as untreated depression can worsen over time and lead to other health problems. Imagine a small crack in a bridge. If left unattended, it can weaken the entire structure over time. Similarly, early intervention is crucial in addressing depression before it escalates and impacts various aspects of a person's life. Encouraging open conversations about mental health and reducing the stigma associated with seeking help is essential. Remember, you are not alone, and reaching out is the first step towards recovery. Section 6. Navigating treatment, a multifaceted approach. Treating depression typically involves a combination of approaches tailored to the individual's needs. Medications, such as antidepressants, can help regulate brain chemistry, while therapy provides coping mechanisms and strategies to manage symptoms. Think of it like treating a physical injury. You might need medication to manage pain and inflammation while physiotherapy helps you regain strength and mobility. Similarly, a multifaceted approach is often most effective in addressing the complexities of depression. Therapy can equip individuals with tools to identify negative thought patterns, develop healthier coping mechanisms, and build resilience. It's important to remember that finding the right treatment plan might take time, and patience is key. Section 7. Supporting loved ones, a beacon of hope. Supporting a loved one experiencing depression can be challenging, but it's crucial to approach the situation with empathy and understanding. Avoid offering unsolicited advice or minimizing their experience. Instead, listen attentively, validate their feelings, and offer practical support. Imagine being lost in a dark forest. Your loved one doesn't need you to tell them to snap out of it or look on the bright side. They need you to hold a lantern and guide them towards a path of healing. Simple gestures like helping with daily tasks, accompanying them to appointments, or simply being present can make a world of difference. Remember, recovery is a journey, and your unwavering support can be a source of strength and hope for your loved one. If you or someone you know is struggling with depression, don't hesitate to seek help. Contact mental health resources like hotlines, support groups, or professional counselors. Your action can make a significant difference. Please like and subscribe to our channel for more insightful content on mental health and well-being.